Hi, everyone. My name is Jérémy Grosfroca, and I am Customer Center Manager here in Europe for GE Healthcare. I'm really happy today to welcome you this morning virtually in our Customer Center in Buc, and here more specifically in the magnet room of our Customer Center. We have here a SIGNA Tuesday Architect installed, and we will use this system today for the live scanning session. Just before to go further, let me just introduce you first Isabelle Dufour-Claude, who will be with us. She is a clinical leader for body in Europe, and as well Rashid Majoub, who will be our moderator for the session of today. Rashid is the clinical leader for Neuro and MSK, and he will follow all the questions that you can ask directly in the chat. And at the end of the session, we will answer to some of your questions. So feel free to ask any question. We are here to answer everything. So let's start on today's topic. Today's topic is body imaging using air coil. So first of all, maybe I should introduce you our air coil. So anterior array, 30 element air coil. So with this coil, we won the Ant Mini Best Radiology Devices Award. And maybe let me introduce you some nice characteristics of this amazing coil. First of all, this coil is really light. It's only 2 kilograms with cable and everything. So when we talk about body imaging, we clearly understand that a patient who, for example, just suffered body surgery, could not handle an heavy weight on his abdomen, will definitely prefer to be scanned with this coil. As well, this coil is really flexible. You can really wrap it as you want, and so you can really adapt the coil to your patient's morphology, which is really critical in terms of image quality. So you can fit, I would say, more huge patient, and in the meantime, also more small patient like pediatric patients. And also, we are talking about body imaging. You can see the coverage. You have an amazing coverage, which gives you the possibility to scan thorax, abdomen, or pelvis without moving the coil, which is pretty important. But it's not only a story about flexibility, about comfort. It's also a story about image quality. With the breakthrough technology embedded inside, you have 30 elements, which give you the possibility to use high parallel imaging factor and to deliver the best image quality for body imaging. I think the best is to start our live scanning session by positioning the coil on our volunteer. We have a volunteer here on the table, ready to be scanned. And let me just position the coil on his abdomen. So you will really see that it's really like a blanket. I position the coil on his abdomen, and I just have to put it like to make it fit to the patient. Now I will plug the coil. So as we are in the magnet room, I would just have to take off my ears for just 1 second, so I'll be back. Okay, I'm back. So as you can see, our volunteer is quite tall, and look at the coverage. So we are now ready to scan, nothing more. You can see, really easy to position. And now to scan, I will need to create my landmark. Again, our goal with all our solutions is to improve the workflow and the experience of patients and users. For that, I will use IntelliTouch, which is the sensitive strip band that you can find on the side of the table here. So with only one finger and only one step, I can create my landmark. I press here. My landmark is created, and then I can send my patient in the ball. So we are now ready to scan. So I see you in a minute at the operator console to start the scanning session. See you.
I take the opportunity during the meantime to highlight several things with this new technology with the air coil. The possibility to combine 2 air coil. For example, if you want to perform a whole body examination, you can also wrap the coil on a leg. This is what we will do tomorrow. for high resolution MSK imaging. And it's also interesting to use this coil if you want to acquire TAP, if you want to have a very big coverage. With only one coil, you have a big coverage, as you can see on this tall volunteer, sorry. And if you combine two anterior array coil, you can do a whole body examination. Let's end to Jeremy to continue the presentation.
Yes, thank you, Rashid. So here we are. We are at the operator console. So let's start our examination by running the localizer. So, as we said, we are talking here about body imaging. So body imaging, and today let's focus on liver imaging. You have a lot of advantages of performing MR for this kind of examination. You have a lot of contrast available, different contrast, a really nice contrast noise ratio. You can make some dynamic study and also quantitative study. But it remains still some challenges by using MR. The two main challenges that you are still facing at the moment is to deal with breathing pattern of the patient and sometimes the lack of signal noise ratio. So let's together today try to understand how we are addressing those challenges with our solution and how we are trying to help our customer on that subject. So let's start by run first an actual Lavaflex sequence. So actual Lavaflex is a 3D T1 gradient echo, flex, which is a Dixon technique for fat saturation. And here, this is, I would say, the standard sequence that you will probably run for all of your examination, most of your examination routinely. So it's 1.5 by 1.5 in plane resolution and 3 millimeter slice thickness. So it's 18 seconds of breath hold, which could be quite long, but with a pretty high in plane resolution and thin slice thickness. So probably the type of sequence that you would scan routinely. Let's scan it. And here you will tell me maybe 18 seconds. It will be probably nice image quality, but it will be too much for my patients. I don't have a lot of patients which can accept and can perform 18 seconds of breath hold. And more, you have to repeat those breath holds several times during the examination. It will be complicated for them. This is why, for the second sequence, we will use what we call Hypersense. Hypersense, it's the compressing technique of GE Healthcare. So as a reminder, compressing, it's random undersample of the case filling of the case space with iterative reconstruction. So by using that, you can decrease dramatically the acquisition time for 3D imaging without compromising your image quality. So here, for example, with exactly the same parameters, so 1.5 in plane resolution and 3 millimeter slice thickness, you have a breath hold of 11 seconds. So you are saving 7 seconds for exactly the same resolution. So let's run this sequence. And just something to highlight also, because it's important to talk about the patient, the user experience here. We created a smart link between all the sequences, meaning that I don't need to position anything at the moment I position the first one. Okay, so let's do the same for 11 seconds. Now, another way to use Hypersense, sometimes you will tell me, okay, 15, 16 seconds, it's okay for me, but I need sometimes to decrease my slice thickness. I need to improve my image quality, but I cannot pay the price in terms of brace hold time. You can use also Hypersense this way. Here, you can have a look in the acceleration tab. We are using Hypersense, and thanks to that, we are decreasing slice thickness at 2 millimeters. So this is another way to use Hypersense. So let's again scan this one. Okay. So as you may heard, I don't know if you heard that, but also the system is managing all the brace hold command with a voice in the language of the volunteer to help the user to really have a smoother workflow. Again, another way to use Hypersense. Sometimes you would need, for example, for arterial phases, to use multi-phase approach. You will need to cover multiple times in one brace hold the lever. Here, this is what we are doing. We have a multi-phase approach with 2 phases, and we are combining that with Hypersense, which gives us the possibility to use higher in-plane resolution, because if you are not using Hypersense, sometimes you will probably have to decrease importantly your in-plane resolution to save time for your patient. So here we can really use, I would say, almost the same in-plane resolution that the previous sequences, but by covering in 16 seconds 2 times the lever. And this is 4 millimeter slice thickness. So let's run also this one. And as you can see here in live, we have all the sequences which are arriving in the auto view.
May I add a comment?
Yeah, maybe Isabel, you want to add a comment on that?
Sorry, can you hear me now? So I just want to add a comment. Why would you need multiple, that we call multiple arterial? It is because we need to have better lever characterization for lesion characterization, in the sense of a better characterization of hepatocellular carcinoma or focal nodular hyperplasia. So we'll need to have multiple and several subsequent arterial phases. So within the same brace hold, we will run just 2 or 3 phases during the arrival of the contrast media.
Thanks a lot, Isabel. So let me just position now the next sequences, and then we will have a look of the image quality. So at this point, we asked 4 brace hold to our patients. So I think we arrive at the point that where most of your some of your patients, would maybe have trouble to hold their breath for a new time. So now, let's say we are now choosing the free breathing approach. So with our solution, you have different type of approach when we talk about free breathing. We will try we will cover a lot today. So first one is the Navigator. So let me just open the sequence. So here you can see automatically the Navigator is positioning on the localizer. It was done automatically by the system after the first localizer. So we know that positioning the Navigator could be sometimes tricky and not reproducible for a user which is not highly trained on this kind of manipulation. So we are helping you to get in reproducibility and in image quality using Navigator. And while using Navigator, we can also still use Hypersense, so compress sensing technique, to reduce the scan time, which gives us the possibility to really increase the in-plane spatial resolution, here 1.3 by 1.2, with a slice thickness of 1.6. So it means that by using this kind of technique, the highest resolution acquisition are available even for patients which have some difficulties with their breathing pattern. Let's save this acquisition. Okay, and so here it's interesting because we have the Navigator waveform which appear automatically. And it's interesting because the user can follow the breathing of his patient. And also on the fly, you can adapt and modify. If you need, you can modify acceptance window or threshold to adapt to if your patient change his way to breathe during the sequence, which is something really interesting for some patients. Okay, let's position the next one. Here, another technique. You just move it, sorry, here. Another technique for free breathing imaging, which we call Lavastar. So Lavastar, it's a 3D radial stack of star technique. It means that using Lavastar, you will compensate the motion only with the technique, with the radial technique, without using a Navigator or bellow or something like that. It's a total free breathing imaging. And here the same, you can achieve pretty high in plane spatial resolution with 3.4 millimeter slice thickness for a time of 1 minute 39. Okay, I think now we have some time to go to the images that we just acquired to have a look of image quality. Okay, let me just split the screen in 4 sequences. So just okay. So first one here. Okay, let's have a total view. Okay, that's perfect. So the first on the left part here, it's the one without Hypersense. It's 18 seconds of breath hold. Here, it's exactly the same acquisition while using Hypersense, and it's 11 seconds. So we can definitely compare here image quality, and I think really taste that we have the same image quality. We have exactly the same kind of details here. For example, I think we have small cyst here in the liver of our volunteer, and we are really we have really the same image quality. The same on the pancreas here, you have exactly the same kind of details. Here you have the 2 millimeter slice thickness in 15 seconds. So here you can see that you have sharper images with a bit less signal, but really high in plane resolution. And something really important to highlight here, we are without contrast for sure, because we have a healthy volunteer. But you know that if you are injecting contrast media, you will improve your signal noise ratio. So it means that you can even push further the limits if you are on site with contrast media. And here we have the same acquisition with a 2-time covering, so a multi-arterial approach. So here you have 1 time and here another one. So you can see that you can, by using Hypersense here, we are maintaining the image quality without any penalty in terms of breath hold time for our patients. I think we can now position the last free breathing technique. So here we are using.
So maybe, Jeremy,
Yes.
you can just display the reformats of the high resolution one.
Okay.
How it fits in other views. Thank you.
Let's compare with this one. And here you can see the 18 seconds breath hold And here, the 15 seconds result with coronal reformat. So by using 2 mm slicing times, you are really improving your image quality in any plane. Okay, let's now position the Discostar sequence. So just before we talked about Lavastar. Lavastar, you remember, it was 3D radial stack of star for a single phases. You can also do that for dynamic imaging, for multi-phase imaging. So this is what we call Discostar. So here, for example, you will make a total free breathing acquisition with a temporal resolution of 5.5 seconds. It means that every 5.5 seconds, without any technique to compensate the motion, except Discostar for sure, you will cover the whole lever. And we are doing that here during 7 phases. Let's run it. And while it's running, let's position, I think maybe one of the last sequences, because I want to save time for your question. Let's position here the T2. So at the beginning of the session, you remember I told you that we have 2 main challenges. We have breathing pattern of the patient and we have signal noise ratio. So let me show you here a technique that we are using to improve signal noise ratio. This is our last and breakthrough technique we call Ericon DL. Ericon DL is a deep learning based algorithm for reconstruction, which is working specifically on raw data to detect and remove specifically noise and Gibbs artifacts. So as you may understand, as we are removing noise, we are improving signal noise ratio, and then we are addressing these challenges. And it will be a totally different way to optimize your sequence. Let me just show you at the operator console what it looks like. Here you have the Recon DL strength, which is where the user can pick his own level of remove of the algorithm. So you have high, medium, and low. And here the same, we are using the Navigator technique as we used just before with the Navigator here for the acquisition. So let me just run this one. Okay. And then while it's acquiring, we will maybe have a look of the free breathing techniques, and then I will open for question.
In the meantime, if I may add something, Jeremy, it's also possible it's not necessary to select the coil. The system detects the coil automatically, as you can see at the right side corner of your screen. And you don't need to manage how to position the coil. You just need to manage how to put the coil on the patient. And remember, this coil is very light, so it will be very useful for your patients who have pain as well. I'll let Jeremy to continue the presentation. Jeremy, we have 5 minutes to the end of the live scanning session. Don't forget, if you have any question, to write your question or to speak out, and we will reply to your question directly in this live scanning session. Thank you, everyone. Thank you, Jeremy.
Yes, thank you, Rashid. So yes, just this one, Navigator 1. So I use a minute just to let you taste how the in-plane resolution is really good, and how the details that you have in the lever on this one. This is for the free breathing. And also Discostar we acquired here. So you can see let me just take it off because it makes no sense here. So here is disco star. So each 5 seconds, without you have the different phases here. You can see here it's totally free breathing. Each 5 seconds, and here you can see even a patient who cannot hold his breath at all is eligible for a multi-arterial dynamic phases acquisition. Maybe Rashid, during we are finishing the last sequence. Do you have any question in the chat box?
No, for the moment we don't have any question. You can continue if you want to present all these possibilities with the Lava acquisition.
Yes, I think I will cover the. Here you can see we have the Coil T2 SSFSC by using RSNA, and we will compare, which will be really interesting here. It will be to compare the exactly same data set with and without applying RSNA. But yes, just maybe something that we didn't mention on the Lava before. But yes, as we said at the beginning, it's a Dixon technique. So have a look at how the fat suppression is homogeneous here, and how the signal is homogeneous here. Okay, let's have a look of this Coil T2 SSFSC. So here on the left side, we have the one by using RSNA. And here on the right part, you have exactly the same acquisition without using RSNA. So there is really a huge difference of signal between the left one and the right one. So you can clearly see that you can now think to scan pretty thin slice thickness. Here, for example, it's 3 millimeter slice thickness in a really short time, 1 minute 27, with a high in-plane resolution with this kind of matrix, without being facing to the noise challenge. So I think with what we covered today, you were really able to taste the large panel of solution that we are proposing to our customers. I mean, we have I think for each situation we have a solution ready. And something also important, because at the beginning we talked a lot about air coil, but you can see here that for this Coil SSFSC Navigator, we have 4 of acceleration. So this is really thanks to the air coil and this technology that we can accelerate at this level. Maybe you want to make a comment, Isabelle, to close the session?
No, I'm fine. Unless we have any other question from the audience. I do not see yet any message in the conversation. Don't hesitate. We have still 2 minutes before the end of this session.
I think it's important, Isabelle and Jeremy, to precise that this air coil with this new technology, very flexible, very light, it's very wonderful for to manage the patient as well. I think it's participate to the patient comfort and to the workflow. I think that the technologists who have to carry a coil, a heavy coil all the day long, it's very a pain for them, and using this very light coil, it's I think a pleasure for them to use this coil. And it's also possible to combine 2 coils as well. You can wrap the coil around the a leg or around the shoulder. It's very interesting to use this coil. In addition to this coil, we have also the possibility to manage the patients. What we saw and what you showed is we can manage the acquisition from very short to very high spatial resolution acquisition, and we can also use this acquisition in bracing or very in free bracing, using this free bracing technique. This is very useful for very old patients or very young patients. So thank you for that. There is no odd question in the meeting in this live scanning session.
Just something to finish. If you
were
impressed by the AirCoil technology, I encourage you to register for tomorrow's session, because for tomorrow is MSK imaging, but we also use the AirCoil for this session. We will, you can see tomorrow you will be able to discover the versatility, the huge versatility of this AirCoil.
So we have one last question about what could be useful for painful patients and pregnant. It's a very good question, because we have recently the case in UK where they were using the AirCoil because none of the other coils were fitting to the patient because she was really in pain. She broke her shoulder. And then we were able to cover and examine that patient very successfully using the AirCoil, because it was the lightest one that the patient could support. And as well for pregnant, as you can imagine, also the AirCoil, you have the possibility to image not only in supine position, but also on the side, when the patient is on the side, or as you will see tomorrow, around a leg or an arm, just to, because the technology of the AirCoil, which enables you to cover and wrap around any type of anatomy. So you can use it everywhere within the magnet. I hope it's answering your question.
Thank you, Isabelle. Thank you, Jeremy. So we reached the end of this live scanning session. Thank you for the question. Thank you for all your the attendees. Have a great day, and see you tomorrow for another live scanning session for this 2020 RSNA. Bye,
Thank
everyone.
you, everyone. Have a nice day. Have a nice congress.
Thank you.